Hi everyone, I'm Dr. Shiva Raya and I work in the Sydney CBD. I have adult patients who are concerned that they may have ADHD and they've never been assessed for it as kids. So I thought I would speak to a pediatrician today who could tell us more on the topic. Natasha Fernandez, she works in the Sydney CBD, she works in the eastern suburbs and also in the northern beaches. So welcome.
Thank you, Shiva. Nice to be here.
Yeah, nice to have you. So can you tell me a little bit about how you would define ADHD?
Yep, so ADHD, or Attention Deficit Hyperactivity Disorder, is a difficulty in individuals maintaining attention, as well as portraying features of hyperactivity or impulsivity. You have three types. You have the hyperactive subtype, which is the children or the adults who can't sit still, who fidget constantly, who are very impulsive in their actions. Then you have the inattentive subtype, where you have, the daydreamers, as they're called, the people who sit and daydream and don't pay attention in a classroom. And then you have the combined subtype, where these individuals have some characteristics from both groups. And the combined subtype is by far the more common one that we see.
Okay. And so at what age, if say a parent is suspecting that their child may have ADHD, can they go and see a pediatrician to be assessed for it? Like, what would be the youngest number that you would choose?
I mean, from in my practice, I think the youngest child that I've seen was just after his 4th birthday. It's always a bit of a fine line, Shiva, with ADHD. I think that children need to be allowed to be children, and there are going to be developmental stages, especially at that young age, where they are a little bit hyperactive, where they don't listen to you, where you can't seem to get them still at the dinner table. So I think that it's very important to try and leave it as long as possible. Generally speaking, I tend to see a lot of my patients when they start that formal schooling years, so kindergarten up, so age sort of 5.5 up, where there's significant features of the hyperactivity initially is what I see. So the kids who can't sit on the playmat or during group times, for example, with the rest of the class, who are very impulsive, who run across the road without their parents hanging on to them. Those kids I tend to see a lot earlier. And then I have the inattentive subtype, the inattentive kids, where I actually see a lot of them only at the start or at the middle of high school, because those are the kids that go sort of under the radar in their classroom. They're not paying attention, they're daydreaming, but a lot of the time they sort of just get by, and it's only when they're sort of in their secondary years that they're significantly falling academically. They are feeling that life is just too hard for them, and so their mood is affected. So generally speaking, I tend to see the inattentive kids a little bit later than the hyperactive.
And what tools do you use to assess a child for ADHD?
So ADHD is largely a clinical diagnosis. We do have like brain mapping, for example, which is quite a new technology that helps with the diagnosis for ADHD, but by and large it's a clinical diagnosis. Patients need to be showing significant features of hyperactivity or inattention in more than 2 seconds. So for a child, that's usually in the home or in the school.
Okay. And what sort of treatments are available?
So the treatments, I like to class them into 2. One is your stimulant medication or medication, and the other is behavioral therapy. Behavioral therapy for younger kids could be an occupational therapist that helps them focus and concentrate in the classroom, helps them regulate their emotion and their impulsivity that quite commonly comes with ADHD, helps them regulate their anxiety that is quite commonly associated with ADHD as well. You have psychologists who can also do similar behavioral therapies. And then you have stimulant medication, so commonly your Ritalin, your dexamphetamine, that can help with the function of your prefrontal cortex, which is the part of the brain that is often affected when we're talking about ADHD. So that part of your brain controls your executive functioning, your reasoning, your short-term memory. If you think of your brain as like an office space, your prefrontal cortex is like the board of directors. It controls all the heavy-duty, serious decisions. And if you have an impairment in that part of the brain, as you can imagine, as you get older, the ramifications of not thinking things through and not concentrating well can come and interfere with daily life.
So if a child is put on dexamphetamine, does there come a point where they don't need it anymore?
Yeah, I see lots of patients who, in their mid-teens or at the end of year 12, they can come off it. That part of the brain, it's not all doom and gloom with ADHD. That part of the brain does mature. And in some people, it matures to the level where they don't need medication anymore. They're aware that they might always be a bit hyperactive or impulsive, but they have that maturity and they have behavioral strategies over the years to help them in their day-to-day, and they don't need medication.
Okay. And so dexamphetamine is a medication. Are they more likely to use non-pharmaceutical forms of amphetamines?
That's a common concern, but research actually shows, Shiva, that patients that are put on stimulant medication to treat their ADHD, so treat their impulsivity, are actually at lower risk then of going on to take recreational drugs, for example, in their teens and in their young adult years.
Oh, that's really great. And so is there anything else that you think is really important for us to know about ADHD as a condition?
I think the one thing that I like to tell my patients or my patients' parents that come and see me, it's not all doom and gloom. It's very hard for a parent to hear that their child has anything, wrong with them. And I always like to sort of really stress that there's nothing wrong with your brain when you have ADHD. Everyone's brain works differently. It's just a different way of functioning. It's just differences in where your receptors lay. And actually, school is hard with ADHD because you have to do all sorts of things, all subjects, whether you like it or not. But once you get out of school and if you just manage your ADHD well through school, people with ADHD have actually been shown to be able to be a lot more successful because ADHD individuals have what we call hyperfocus. So when they find that thing that they love and that they're really good at, they can really hone into it and do really well. Albert Einstein, for example, had ADHD, and look how well he did.
Yeah. Okay. Well, that's really great. So looks like we've got a few little ones with some attention problems here and hyperactivity. But I think we'll wrap it up with that. So thanks so much for your time and for your insight.
My pleasure.
We hope that helps you as well.